This is the basic set for laparoscopic cholecystectomy. Just basic for new beginners. In this video, we are going to provide you the basic details how to be a good second assistant in simple laparoscopy, simple laparoscopic cholecystectomy. Betadine will be collected in this bowl. This is the sponge holder. You will clean the patient with this instrument. This is scalpel handle used to give incisions. It is passed to the surgeon fitted with 11 or 15 size knife used for making incisions. After making incision of the umbilical cord, this varese is used to create pneumoperitoneum. 5 ml dispo is needed to check whether the varese is in the abdomen or not. After proper pneumoperitoneum, umbilical trocar with cannula is placed under proper control for camera vision. Under camera, the epigastric port is placed, followed by the other two 5 mm ports. After proper port placement, 4 ports are placed parallel. This is, you can see, to the surgeon's right hand. This is bowel grasper used in laparoscopy, and in laparoscopic cholecystectomy this is given to the surgeon's left hand. This is another instrument that is used to grip the fundus of gallbladder, and it is always in the surgeon's assistant's hand, whether in the second assistant's left hand or third assistant's first hand. This is laparoscopic scissor. This is used after Callot's dissection. When we put clypeus in the, this scissor is used to divide the duct. Then this is laparoscopic cautery hook. Some surgeons use it for dissection and some hand. It is always given in the surgeon's right hand. This is suction irrigator. It is used to suck the fluids from the abdominal cavity or to give the irrigation, normal saline irrigation. These are the two clip applicators, 300 and 400. And clip is fitted. I will show you how the clip is fitted in this. This is 300 clip applicator and this is 300 laparoscopic clip. See clearly I am fitting this, and this clip is now loaded. These clips are used to clip the duct and cystic artery, cystic duct and cystic artery. This is GB extractor. It is Elise type extractor to extract the GB from abdomen. This is a stone extractor. In some surgeries, when the stone slips out from the GB in the abdominal cavity, the stone extractor is used to extract the stone from abdomen. After extracting GB through the epigastric port, the GB is hooked with these instruments, open instruments, long 2 kgs and a short artery forceps. And this ohm forceps is used to extract the stone from the GB, so that it gets easier to take the GB out from the epigastric port. And these two instruments are used to stitch back the incision sites. This is the basic setup for a new beginner. Okay, thank you.